Delhi is perpetually choking, usually due to pollution, but at this moment due to lack of oxygen in hospitals. And do you know why? A case in Delhi High Court revealed that the Delhi government is not able to find tankers to transport oxygen that's already been allocated to them by the centre. Looks like Mr. Kejriwal was expecting doorstep delivery. Namaste, welcome to the Bottomline. Health is a state subject. The makers of our constitution decided that the delivery and the administration in the health sector would be through state governments, even though the centre can facilitate them. However, have our state governments covered themselves in glory? When the country needed the political class to come together to fight against the pandemic, leaders such as Mr. Akhilesh Yadav made shockingly irresponsible comments on the vaccine, calling it the BJP vaccine. Mr. Rahul Gandhi took a jibe at the Indian vaccine manufacturers, maligning their work. Chhattisgarh, Kerala and Punjab state governments shocked everyone by refusing to use Indian-made Covaxin, openly creating vaccine hesitancy. Some of these states are bearing the brunt of the second wave of COVID now. The second wave. Who could have known it was coming, right? Some states are claiming that the central government did not alert them that the second wave was coming. This makes us wonder whether the chief ministers of these states do not read or understand communication from the Union Health Ministry or the Prime Minister himself. On 7th January 2021, the Union Health Secretary had written to Maharashtra, Kerala, Chhattisgarh and West Bengal to maintain a strict vigil and to not squander the results gained so far. The Health Secretary specifically drew attention to the low and declining testing rates in these states. On 17th March 2021, when the second wave had not yet taken off, Prime Minister Narendra Modi interacted with chief ministers of states and said that they needed to act quickly to avoid a second wave of COVID. Can warnings be more unambiguous? Today, the situation in some cities is such that people are struggling for the most basic things: beds, oxygen, medicines, and quarantine. Aren't these most basic things that a state government should be working on? It isn't rocket science to work towards these, especially after learning the lessons from the first wave. Yet, in Maharashtra, there were scams reported in something as basic as quarantine. International travelers could escape quarantine by paying just Rs 10,000. In August 2020, Mr. Arvind Kejriwal was promising home delivery of oxygen. What happened to that? Now his government is unable to deliver to the hospitals even the oxygen provided to it. Maharashtra faced oxygen shortages even in the previous wave of the COVID pandemic. So why is it that no lesson was learned and oxygen supply set up? Setting up oxygen plants to make hospitals self-sufficient is surely something that could have been done in all the states. Let's come to availability of beds. There was a poignant story of a COVID patient protesting the lack of beds in NIJ, Maharashtra, who tragically died later. Who's responsible for this lack of beds, even after a year of the pandemic? Testing is key to containment. Lack of containment creates waves. Why is testing lagging in so many states? Just a few days ago, the alarming test positivity rates of Maharashtra and Chhattisgarh stood at 28% and 48% respectively. Punjab is in the grip of a disaster that very few people know of. How is it that Punjab gets no questions asked about the really high mortality rate? Another major point that seems to have disappeared from the media narrative is the migrant crisis in Delhi and Maharashtra. Just like last year, the centre has had to step to provide 5 kg free food grains to the poor. There has been nothing done by the states. Migrant workers are the gears that run the economic engine in several states. Why is it then that states will not shoulder any responsibility towards them? The first wave was certainly unprecedented. It needed a coordinated approach with guidance from the center. We all agree with that. It needed resource allocation at a scale that only the center could manage. Precision planning and a calibrated roadmap were responsible for the first wave passing off with a degree of relative normality. States should have picked up the learnings from the approach and should have been able to manage the situation all by themselves in the anticipated second wave. However, instead of having a process-driven approach, there are ostriches galore. Every single thing that the states are demanding from the center today, oxygen, remdesivir, beds, each of these could have been handled at the state level if it was done in time. If the first wave was a made in China crisis, the second wave is surely a made in states crisis. Hard questions need to be asked, not just by us, but also by you. Namaste.